Yesterday, I made a video in which I said that some of my colleague doctors may be giving patients a raw deal because they book more patients in their private practice, in their offices, than they can see. And so, in order to clear the long queue, they spend minimum time with patient, but this minimum is below the recommended minimum by the World Health Organization. And I say that this may be compromising on the quality of care, and therefore their patients are not getting the best. I said the minimum recommended contact time between a doctor and a patient is 15 minutes. This allows for the doctor to talk to the patient, to examine the patient, to fill out the notes and the prescription. And sometimes it can be longer if the patient has a complex problem. And so I said I went to see a doctor, took my relative to see a doctor, and I was given position number 57. This doctor had more than 60 patients to see in a day. And I said, if you use the minimum recommended period of contact between a doctor and a patient of 15 minutes, then this translated to 900 minutes, which is like 15 hours in a day, longer than a working day, a normal working day of 8 hours. And so I got good responses from my viewers and also from my doctor colleagues. My colleague, Dr. Juma Buika from Aga Khan University, asked me, so how long is it supposed to be? How many patients? How much is too much? And I thought I should clarify this a bit more. So if we're using the recommended 15 minutes contact time between patient and doctor, then that means every hour a doctor is supposed to see at most 4 patients. And if the patients have complicated problems and you take longer than 15 minutes, then there will be less than 4 patients per hour. And so if you have a doctor who is working the normal 8-hour working day from, say, like 8 in the morning up to 5 with a lunch break of 1 hour and some breaks in between, about 8 hours, then this doctor is supposed to see 32 patients at the most. But remember, we have a lunch break. They need to take some lunch break, 1 hour. We have some tea break in the morning, probably in the afternoon. Then we also have some health breaks. The doctor will need to take some little breaks. The doctor will need to maybe visit toilet, help themselves, take some breaks, And so if you factor in that, then you see from those 32 patients for an 8-hour day, you will reduce that by about 7 patients to come to about 25 patients at the most. And so a doctor is not supposed to see more than 25 patients in a day. And so if you are seeing in your private office, your booking book has got more than 25 patients, that's probably too much. And remember, this requires you to be working 8 hours. Most doctors don't work 8 hours in their private offices because, as I said, they go to see inpatients who are hospitalized in the various hospitals outside their offices. And so when this number exceeds that recommended maximum, this is probably a good time to consider hiring a helping hand. Right now in the country, we have many doctors who are unemployed. So it's a good idea. You create employment. It's a win-win situation. You get a helping hand. The patients coming to see you in your office don't have to wait for too long. You don't have to spend very short time with the patients because you're trying to clear a queue. And your assistant doctor could even just be a junior doctor recently graduated if you can't afford to hire a very experienced doctor. And they can start by helping you with simple tasks like filling out routine prescriptions, giving routine medications, routine basic reviews of patients you have seen before. And this will ease the load on you and reduce the queue. Then also, it is a good idea to employ technology. Some of the patients who are coming to see a doctor do not need to be seen by the doctor per se. They are coming for refilling of prescription. Some of them are returning results from the laboratory, from the X-ray department, like I said in yesterday's video. And they could be seen by an assistant, and they can also be helped through technology. A prescription, a patient can request for a prescription through a phone call, an SMS, a WhatsApp message, and it's received by your secretaries or the front office. The file is removed, and the assistant doctor or even the main doctor can write that prescription, and they are having a little break in between seeing the patients who must be seen. And these prescriptions can be dispatched to the patients electronically or by a courier. And we have many courier services, border riders and all those, so that patients don't have to come and fill up your office because they want a refill of a prescription when you have technology available, when you have junior doctors. I remember when I was a little junior than I am now, I used to work for Professor Gaku in his clinic on Menelik Road, Nairobi. I was working with my good friend, my colleague, Dr. James Karanga. And the professor would channel these simple tasks to us. In the process, we learned a lot how to deal with the orthopedic patients because his was an orthopedic clinic, he's an orthopedic specialist. And we lessened the workload he had. At the same time, we learned something new. We earned something for ourselves. So these are things that can be used by doctors to reduce the queue and allow them to have quality time, give quality service to their patients who visit them, so that the patients will leave satisfied, feeling that they have been listened to, they have been examined, and they go home happy and come back. Because I've seen some of the patients who come to see us, the psychological feeling, the psychological satisfaction that they have been listened to, they have been seen, they have been examined, is very important. If you are this sterile doctor who does not want to touch your patients, examine them, some of them will say, "Hata hakuniangalia, he didn't even examine me, he just wrote something." And so this makes them feel like the service was not of quality. And maybe it's because you're rushing through to clear your queue, and this patient probably just needs a prescription. I'll just write a prescription without even having to examine them. But it's not taken well by patients. So I think this is a further clarification to what I said yesterday. And thank you for those who send in their comments. I invite more people to send in their comments. Tell me about your experiences as a doctor, as a patient who has visited a private doctor in his clinic or even in a public hospital. And let's keep this conversation going, because it's good for us, it is good for the healthcare system and for the country. See you in another video of Dr. BMS. As you remember to subscribe, share, like this video to keep the channel growing and the conversation going.